This meeting is being recorded.
Okay, wonderful to meet you today, all of you, meet with you. This meeting has changed a little bit. I think you might have seen that in the revised schedule that was sent out. Tim Lutz, our new Director of Health Services, who's fantastic. He was going to come and be introduced to you today, but that will happen in February. He's attending the Board of Supervisors meeting. That meeting is on hearings and presentations on the issue of how to address the reduction in jail population and the consent to meet the consent decree in many ways. So it's very kind of has garnered a lot of interest, to say the least, and we'll be hearing public comments for many hours. So let's get on with our business. And I'm going to ask for approval for the meeting minutes. So is there anybody who would like to propose a motion?
This is Phil. Motion.
To accept the meeting. Thank you. Nice to see your square, Joe Phil. Is there a second?
Second, Steve Heath.
Great. Thank you, Steve. You're always up there helping out here.
It's in my job description.
That's great. Okay, so we need a vote to approve the minutes. We can put a show of hands on, I guess, the gallery, or you can unmute and I'll just, does everybody know how to put their hand up?
About without objection.
Yeah, well, I think we have to go one by one. So hands, thumbs, anything you want to put up. Okay, 1, 2, 3, 4, 5, 6. Okay, 7. All right, minutes approved. Thank you all very much. We shall continue on. Next on the agenda is I would like to say at this point, probably a good point, our PHAB membership is changing, will be changing as of the end of December. Joe Phil and Steve and Barbie and myself will be terming out. And so I want to take this opportunity first to thank Barbie and Joe Phil and Steve for their wonderful membership on this committee. You have offered many wonderful opinions and interesting observations. You've done work to help the activities of this committee, board, including Joe Phil and Annie, who is no longer with us, were instrumental in providing opportunities for the youth and ambassadors to. What they did was they actually produced a whole masking campaign at the very beginning of COVID. And they did all of this. They researched who could do it. They helped for the photo shoots and the social media campaign. It was really amazing. So thank you so much, all of you, for what you've done. And we will miss you. And the county is better for your service, and that's pretty wonderful. Okay, so on to business, more business, Public Health Division update. Dr. Kay, we look forward to hearing all the interesting facts going on in the health community in our county. Take it away.
Well, I guess the disease du jour is a new one called triple-demic. We just got the update on COVID. Our numbers are starting to climb pretty quickly now. 12 per 100,000 last week, and now it's gone to 19 per 100,000. We're also seeing an increase in flu cases. We're in the medium transmission range, according to the state. And then for COVID, we've moved from low to medium community transmission. So with that, we actually had to send out a reminder this morning about the CDPH masking mandate, which does require that when a county goes into either medium or high community transmission, that certain facilities, including homeless shelters and jails, have to reinstate the universal masking mandate. So been busy trying to make sure that everybody knows about that. And then for the general public, it's strongly recommended, but we are not planning to issue any additional health officer orders in case someone is wondering. RSV is still going up, though there might be some early signs of it tapering off, but still a huge impact on hospitals, pediatric ICUs, especially because Sacramento County provides services not only for Sacramento residents, but also actually provides pediatric services for almost the whole of Northern California, because a lot of the smaller counties don't even have pediatric units. So the medical directors have been working to find ways of being able to assist by providing assistance through telehealth to other hospitals, as well as extending hours, and as well as asking the adult side to take on some of the older children. But now the adult side is being hit by the flu as well. So it's been quite an impact, and we're not even at Christmas yet. We've just gone through Thanksgiving. So yeah, we're bracing ourselves for the winter. The last couple of years, the flu and RSV have been mild. And this time, I think we're seeing the first impact of not having those preventive measures with required masking or with other restrictions and 6 feet separation. So the hospitals are seeing a huge impact. I think that's the main thing that's keeping us busy. I did want to, if you don't mind, just want to thank the members who are terming off. Just wanted to say how much we appreciate all the work that you and the partnership that we've had with you. I know even through COVID, I think one of the major things, apart from what Fala mentioned, was actually helping us to set up the community forums, which were very helpful in us being able to get the message out and debunking a lot of the myths and misinformation that was circulating. So I thank you again. I'm hoping that even as you term off, that you're not going away, that you just will be one of those who will come in and make comments, but won't be allowed to vote. So again, thank you for your service on this committee. I'll turn it back to you, Fala.
Thank you. And yeah, thank you, Steve, for setting that precedent of FAB members not really ever disappearing. And I think certainly I will be hanging around. We'll talk about transitions a little later, but I'm not going that far. I would like to actually say thank you to Steve. You'll see these flowers that he delivered yesterday. Steve was thanking me for actually taking the chair position. I think he was a little concerned, and maybe there was a lack of disclosure on his part. I don't know. The workload was not anticipated, but it's really been an amazing experience for me to be able to opportunity to be able to serve the board and to serve with all of you incredible members. You blow me away, guys. You're amazing. So
if we were meeting in person, we would have brought a cake, but we'll just have to do it virtually now.
Okay, I'm looking forward to those pretty emojis. Okay. All right, so we'll come back to some of this later. Thank you, Dr. K. Are there any questions for Dr. K? I see Phil's hand up.
Hey, thanks for the update, Dr. K. And yeah, I'm definitely from the ER perspective feeling the triple-demic that you referred to. And I work part-time in Nevada County in Grass Valley at the ER up there, where we do not have pediatric capacity. And there have been a lot of challenges with transferring pediatric patients to our pediatric hospitals in Sacramento and elsewhere. And we've had to send people to Nevada and other places in the state. And I'm just curious if there's any kind of discussion about kind of surge capacity as we're, planning on experiencing a further uptick in these cases, and especially these rural hospitals, I think are going to be really strained trying to get patients either to Sacramento or the Bay Area for their specialty care. And so I'm just curious if, if there's any plans to bring in additional nursing staff or any other kind of emergency planning on that front.
Thanks for that question. We've been meeting on a regular basis with the medical directors to discuss the issues. We've also been meeting with the state. Unfortunately, there are no additional nurses to bring in. Pediatric nurses, I'm finding out, are very rare. And it so happens that because this is hitting the entire state, that everybody is scrambling for the same group of nurses. And so it's been very difficult to get any additional staffing. And in fact, in talking to the pediatricians, I think one of the major problems they say that they have is actually the staffing. And some of the nurses have had to work back-to-back shifts just to be able to keep beds open. So yeah, unfortunately, no additional staff.
Thank you. That's truly unfortunate. Barbie, I did not see your hand over there. Did you have a question?
I did have a question. I just my connection timed out, and while Dr. Couturier was talking, and I heard mask mandate, but I didn't get all of what she said. Are we moving back towards a mask mandate indoors, or what was the full content of what was said there?
What I said is that the CDPH does have a mask mandate, and because now the county has moved to the medium range for community transmission according to the CDC database, we now are required to have certain facilities are required to reinstate universal masking, and that is the jails and homeless shelters. This is, I think this CDPH masking mandate was, the latest update we have was in June or July, Nick? I can't remember which one it was. But so it's been there. It's just that we've been in low transmission, so nobody had to mention it, but now we had to say it because we've moved up. And the last thing I said also is that we do not have plans to issue a local masking mandate. So we will remain on the strong recommendation for masking.
Thanks for repeating that. I appreciate it.
Okay. Thank you, Dr. K, for the update. I think Nick has put the link in, and they can click on that, I presume. Yeah.
Should be able to. That's the masking guidance from CDPH that includes the language that Dr. Couturier was referencing.
Great, that's in the chat. Okay, thank you. On to the Primary Health Division update. I want to thank Andrew for being here today and providing this update. There are changes that have occurred, including Dr. Sandy Damiano's retirement, her extremely well-deserved retirement, and the hiring of a new head of primary health who will be on board probably, I think in February is what I heard. So we are very grateful for Dr. Damiano's incredible support of FAB and our work here. She has been so responsive to all of our requests, also supplying this board with valuable information to keep us informed and basically helping us do our work. Our gratitude and appreciation to her, and best wishes for her retirement, a long and healthy, happy retirement.
This is
So
George.
that-
I have to leave.
Sorry, George?
I have to leave. I have a family emergency. Bye-bye.
Oh, I'm sorry. I hope everything works out okay. Thank you for letting us know. Now over to Andrew for an update.
Yeah, definitely. Yeah, I echo those sentiments. It's been a pleasure working underneath Dr. Damiano. I got a chance to start working with her in 2004. It's been great to be directly reporting to her over these last few months, and definitely wish her the best. I've been in communication with her up to just recently, and it seems like she's getting excited to enjoy retirement. So I think she's still somewhat connected as she's kind of handing the reins over to Tim, and I got a chance to meet the new deputy director yesterday, Noel Vargas. And so it looks like he's going to be up and running here probably early to mid-January. So he's joining us from one of the larger hospital systems. And so just getting a chance to kind of get to know him and his background. So I think he'll be a great addition to the primary health division. And so excited to get him on board as well. So all the division managers got a chance to meet him yesterday. So I'm so excited to have him on board. I think Tim will be excited to have him as well, just because having another deputy on board and having all the DMs not have to directly report to Tim, I think will be a happy relief for Tim. So, but what I want to do today is just kind of give you, I prepared a presentation for Tim as part of his onboarding. He thought it was very helpful for him, and he asked that I present this to you. And Sandy also saw this, and Sandy said, you know what, this is actually something that I think PHAB would be very happy to see. Just as this is our most recent numbers for what we are seeing over at the health center. For those of you that don't know, I'm the division manager for clinic services for the county, and also the health center director for the Sacramento County Health Center. So we just recently got our data of how many patients that we're serving. And most recently, we were the recipient of a variety of grants from HRSA, so the federal agency that that oversees us. We're a federal qualified health center here over at the health center, so we have a bunch of federal grants, and we recently got awarded some new grants. So I thought maybe it's time for just to give you a very quick couple-minute oversight of some of the new grants that we have and some of the numbers of patients that we're seeing, just to kind of give you just kind of a snapshot of what we have going on and any questions that you might have. So it's okay, Nick, I'm going to go ahead and share my screen. You have it? Oh, perfect. Awesome. I wasn't sure if you got that or not. I sent it over to you kind of late. So just a quick overview of the health center. We are an FQHC, Federal Qualified Health Center. We provide primary care and behavioral health services to low-income residents of Sacramento County. We provide low and moderate services in regards to behavioral health services. Any severe services, we do refer back over to the Behavioral Health Services Division over in behavioral health. We are located at the Broadway location. If you haven't been over here, feel free to reach out to me. I'd love to give you a tour. Broadway and Stockton Boulevard is our location. We are co-located with a variety of services, mainly a lot of public health services. We're co-located with the WIC, the chest clinic, the sexual health clinic, county pharmacy, Sacramento Covered, which helps folks get insurance. And then we also, a lot of folks don't know, but we also are co-located with Quest Diagnostic Lab. So we actually brought Quest in-house. So we were finding a lot of folks sending folks out, especially with our refugee clinic. We have a very large refugee clinic here in the county. Getting folks sent out and getting their labs done, it just wasn't working. So we actually brought Quest to us. So we actually have Quest here in-house. 99% of our service providers are contracted providers through University of California, Davis faculty and residents. So we have a very large contract with UC Davis. And then we have a couple county doctors. Our medical director, Dr. Sumi Mishra, is our medical director. And then we have a couple other county doctors and nurse practitioners that are employed through our county system. And then we are currently working with a variety of other arrangements to possibly reach out and bring in Kaiser Fellows as well. But we are exploring those possibilities. Not sure if that's going to work out or not, but I'm always looking to expand our system of care here in the health center. Just a quick snapshot there of our medical specialties and services that we provide. Adult primary care, OB, family medicine, pediatrics, psychiatry, and integrated behavioral health. sometimes referred to as IBH. We do chronic disease management, communicable disease screening. We do have an on-site lab in radiology, PrEP prescription and rapid HIV testing, which I'll talk about in just a few minutes. That's one of the new grants we just got from HRSA. It's a 3-year, about $1 million grant to start folks on PrEP, which is the prophylactic HIV medication, both the oral and the injectable, long-term injectable medication. We're going to be doing that both here in the clinic and in some of our field services that we have a field van that we're actually using going out into the field, into homeless encampments and out into loaves and fishes. We're going to be doing PrEP medications out in the field as well. And then we do pediatric preventative dental as well. So a lot of folks don't know that. So we actually have that service, which is a fairly new service that we recently added to our health center. Our patient mix is mainly Medi-Cal patients. We use UCD, HealthNet, River City Medi-Cal, Medical Group, and Nirvano, and within those are most of the Medi-Cal plans that you would expect. Most all Medi-Cal plans we accept here. We also see Medicare, sliding fee scale, and then a healthy partner. For those of you that are not aware, that was the county plan that was initiated for folks that weren't quite qualified for Medi-Cal. The folks that didn't quite get the California version of Medi-Cal, we offered Medi-Cal through the county. It was kind of a restricted Medi-Cal plan. We anticipate this will be going away here in 2025 as the governor's proposal for Medi-Cal for all goes through. This won't be needed anymore because everyone will have Medi-Cal. But in the meantime, we do offer this to residents as well. So our numbers here, just so you're kind of aware, we are continuing to trend up. We're excited. Our numbers are going up in all categories. As you can see, 2020, we had 11,000 patients assigned to us. 21, we had 12,000. And in 2022, up to October, where we last got our data, we had 15,000 patients. So very, very excited. Over there in that far left column, as you can see, we had 34,000 visits already completed this year. And we're anticipating ending out this year at probably around 38,000 or so visits. So we continue to go up and trend up year after year. You can continue to scroll down for me, or scroll up, I guess, Nick, for me. Refugee, we have a large refugee program here that's funded and supported by the California Office of Refugee Health through CDPH. It is continuing to get designation as a model program through CDPH. For those of you that don't know, Sacramento continues to be one of the largest settlement areas for refugee resettlement, especially for the Afghan population. We are seeing a huge influx for the Ukrainian refugees. And so we are seeing huge numbers of Ukrainian refugees coming into our refugee clinic. And so that is continuing to drive up our numbers here. Unfortunately, we've had to go back to the state multiple times and get re-ups of money and resources because we're blowing through the money that was actually set aside for Afghan resettlement and services. And because of the influx of Ukrainian refugees, we've had to, and the state's fine, the state continues to give us more money for it, but we are certainly seeing high numbers of refugees here in Sacramento. And they recently told us that we're one of the largest clinics here in California and probably one of the top 3 in the nation when it comes to refugee numbers in the nation. So some of the programs that we have here in the clinic, just so you're aware of, we have the Foster Circle Clinic, which is for foster kids. We have Loaves and Fishes. We have a satellite program out in Loaves and Fishes where we 2 days a week we do services out in Loaves and Fishes for folks that are coming in for services there. We recently launched a mobile street medicine van where we have our doctors. We have a partnership with public health, or one of the public health folks go out with us, and we provide services out in the encampment and variety places in Sacramento. And that's excited. Probably going to be scaling that up to 5 days a week very soon, as we can. Some of the health plans are wanting to fund this full time, and so we're excited to continue to take this full time. We also have a school-based mental health program that's continuing to go on about 2 years now, and the goal of this is to have mental health in all the schools, in all the Sacramento-based schools that are in part of the Sacramento County Office of Education. And so they're continuing to scale this up, and this is comes through the federally qualified health center through my center. And so we provide administrative support and clinical support for this program. We have a variety of HRSA grants, as I talked about. One of the big ones that we just recently got is the HIV grant, which is to reduce HIV infections and to get prophylactic support, condoms, training for providers, and a variety of other services out in the community over the next 3 years. Some of the challenges we are experiencing, just so you're aware of, as Dr. Cassiere mentioned, we are also experiencing shortage of nurses, pediatric nurses mainly. In our peds department, we are experiencing a significant shortage of peds nurses. And so we are looking at registries. We're adding, looking to whatever we can do to try to get peds nurses. But unfortunately, same as Dr. K is talking about, we are having a hard time getting nurses. Space, we are outgrown our space. So we are looking at satellite clinics. We are looking at partnering with other agencies to look at space elsewhere outside of our walls here at Stockton Broadway. But money is obviously a factor. Refugee resettlement, as I talked about, as more refugees come in, it is putting a strain on our clinic. And then we just had a rapid growth in 2018 and 19 where we brought more providers and medical services in, but now we have to then now bolster up our support staff, such as our MAs, OAs, and all the other things now to kind of catch up on that, and that then has a rippling effect on our space and all of our other services. So some of the challenges that we're continuing to kind of navigate. So just wanted to give that as a kind of a quick update on where we are at the health center as we kind of wrap up our calendar year. Any questions that I can answer, feel free.
While we wait for questions, I just want to say I am just amazed at everything that you've accomplished and looking at so many services and facilities that are available and ramping up where it's needed. This mobile van is terrific, as well as everything else. So that was an excellent overview and gives me an appreciation for all the work that you're doing and that the county is supporting. So that's terrific. Joe Phil has a question.
Thank you very much, Dr. Mendonça, for that update. I was wondering, with the anticipated deficit in the state budget, a lot of the new programs that the county did receive in the last 2 years were discretionary funds that were affected by the summer budget. Has that been considered in talks with the county executive and the CFO as to how we will potentially work around the reversal of the windfalls and instead maybe tighten our belts a little bit should there be cuts upcoming this January revision, or actually January updates?
Yeah, as we approach our growth concepts for the next fiscal year, we approach our growth concepts very conservatively with anticipation that the economy would probably likely have some changes in the economy, and looking at those kind of factors in regards to property taxes and those things like that. We are certainly looking at those factors from a very conservative lens. And so we are anticipating that the previous years are probably not likely to continue into the next few years. And so, yes, and so we're looking at that as well. We're very fortunate that a lot of the things that we have at this health center are federally funded versus state funded. And so we do have a little bit of a cushion, unlike I think a lot of the other divisions. And so I think we are fortunate over here. But yes, we are aware that there will probably likely be a downturn in the near future. And so we have prioritized some of our operations in anticipation that if we do need to make some cuts, what those might look like.
Thank you, sir.
Yeah.
Okay. If there aren't any other questions, thank you so much, Andrew.
I think Steve might have a question.
Okay, I'm not seeing that, but go ahead.
Yeah, just a quick question. For a number of years, Dr. Damiano would bring information about the Healthy Partners program that she put together. The budget was always a shoestring kind of budget, and there was a limit of 4,000 patients at that point. And I'm just wondering, is it more secure at this stage? Is there issues now that should be brought to PHAB's attention?
No, actually, we're actually seeing a decrease in inpatient numbers in Healthy Partners, just because as the governor's Medi-Cal for All has continued to expand, we're actually seeing less and less patients utilizing that program. So we're actually seeing the treatment account and Healthy Partner account actually trending down. So we anticipate, as we prepare for 2025 for the Medi-Cal for All, assuming that continues to go forward, we're seeing savings in that particular area. So if you'd like, we can continue to present those numbers to PHAB on a regular basis.
Thank you.
And just wrapping up, I'd also like to follow Dr. K's thanks of the outgoing members of PHAB serving in my role when I was with BHS and Lori's unit. I very much appreciated the support that the members leaving PHAB had for the initiatives at BHS and SUPTI. So I just wanted to thank you guys that are leaving PHAB and all the work and support that you guys gave us.
Thank you. Okay, so onward to Lori and an update from the Substance Use and Prevention Program. And I want to embarrass her greatly because she deserves it. If you missed it, there was a PBS news hour. Part of that news hour was dedicated to Lori's program in getting Narcan in schools in Sacramento. This is national news. Like, this was terrific, and obviously not just helping Sacramento, but really educating the nation about what we need to be doing in schools. So it's an amazing accomplishment, and she works tirelessly, and she's been giving us updates on this, and it's so wonderful. Congratulations on this success. So over to you.
Thank you, Farla. That's appreciated, and it certainly is a team effort, not just with my unit, substance use prevention and treatment, but it's a partnership with the Sacramento County District Attorney's Office and a new organization called Arrive Alive that is the main organizers of these events in the schools. So again, it's not just me and my unit. It really takes, a variety of different departments and organizations working together to make a difference. So thanks for that. And I do have just a couple of updates around the substance use prevention and treatment work here in our county. The first is that we continue to try to expand capacity around withdrawal management and residential treatment bed capacity. And in the last year, we've been able to add about 50 beds between 3 providers, and we continue to need residential beds here. And so we will, we're putting all of our efforts out there in the community, trying to find new providers to enter our service network. And so we will continue in those efforts and updating you as we get more providers coming on board. Secondly, I wanted to provide some data, which I typically do around meth and fentanyl. It's just the data is getting, just really scary, and the numbers are increasing. And so it's a huge concern here in Sacramento County with regard to methamphetamine and fentanyl. So from January to November of 2022, our most recent data that I've received is that we've had 214 meth-related deaths and 137 fentanyl deaths. Now, these numbers are increased from last year because last year we had 116 fentanyl deaths. So again, it's already up to 137. And then last year we had 205 meth-involved deaths, and we're already up to 214. So it's a concern. We have a lot of services and programs and initiatives in place to address both meth and opioids and fentanyl, but we still have work ahead of us, obviously, because the numbers are rising. And again, these numbers are more than homicides and homicides with a gun here in our county. So huge concern, and our office and partnership certainly with public health and primary health and other departments are working, toward addressing both of these substances here in our county. And I will continue to provide reports to you moving forward on those numbers and the work that we're doing as well. Thirdly, I wanted to give an update to the PHAB around the OD MAP project. We were able to hold a stakeholder meeting on November 29th with over 65 people in attendance, providing their feedback, comments, concerns, frustrations, fears around bringing overdose mapping here to Sacramento County. And so our office is still kind of compiling that data, looking at and analyzing kind of some of those comments and being able to report back to some of those attendees around their questions as well. But it was, again, a very fruitful conversation. A lot of different directions that people took the conversation, and we take those comments to heart and trying to strategize how we're going to use this data moving forward from substance use prevention and treatment and public health. So I do appreciate that partnership with public health, and we will continue these conversations. I would probably like to have a follow-up meeting as we look at all of this information, maybe in late January. So more to come on that. And then I also wanted to give the quick update around the fentanyl education and awareness project in the schools, and Farla alluded to some national attention around that. So again, we will continue our efforts in middle schools and high schools. So we are currently scheduled in all of the school districts right now, and we meet with parents. And so we have a parent Q&A prior to any school assemblies, talking about, the dangers of fentanyl and counterfeit pills. The fact that fentanyl is in, most illicit drugs here in our community, pills and powders, also being seen in marijuana and vape products as well, according to our district attorney's office and their crime lab as well. And so, again, this is a prevention effort that will continue, and fentanyl poisoning or overdose is 100% preventable in this county if we continue to get education and awareness around this concern and this epidemic and this crisis. So I will continue to give you updates moving forward on those efforts. And then in addition to this PBS special that Farla mentioned, I did want to give a shout out to Dr. Mendonça. He and I also did a presentation at a national conference, National Stimulant Summit, around all the work that we are doing with methamphetamine, a lot of cutting edge, innovative type programming to try to address methamphetamine. And again, the stigma around meth is a little bit different than opioids or fentanyl. But it was great to get that national attention and had other jurisdictions and states reaching out to us around our great work and collaborating and our coalition work and just the new and innovative ways we're trying to address this issue. So thanks, Andrew, for partnering with me and presenting with me at that national conference.
Fantastic. Lori, I have a question for you. Thank you for that presentation. It's great to hear about the work and the successes happening. But it's depressing and devastating to hear about the increase in deaths. I don't know what's going on the law enforcement side in efforts to stem the flow of these drugs in. Are you aware of what is happening and what efforts are in place?
I don't know in terms of the border, but we do work with, all of the law enforcement agencies. And one of our biggest partners is the high intensity drug trafficking area team. And they get all of the data and information from other law enforcement agencies that, are part of these seizures with both meth and fentanyl. Cocaine is on the rise again, and, other substances, but we do get reports from them, but I don't know in terms of enforcement, say at the border, because these drugs are coming in from China and other India and other places. So.
Okay, thank you. I know it's outside your area, but thank you. Any other questions for Lori? Okay. All right, we move on. Thank you. All right, to more mundane business of the board. We are addressing some potential changes in the bylaws for FAB. We have bylaws that were updated, well, a year or two ago, and I'm in contact with Rick Heyer, who's our county counsel, in advising me as to how this needs to take place. What we did a couple of years ago was change the number of members on the executive committee. And we approved that as a board, and it was implemented. We changed the bylaws, but Rick has said that it's best to include that change as well as these that we're going to vote on now, as we prepared to send these to the Board of Supervisors, because there's certain ones that probably need approval from them. So we're looking at two more changes. One is the co-chair positions, and currently, if Nick makes that a little bigger, I'll read it off of that, or I can bring it up too. Yeah, that's great. Thank you. So you see here what the bylaws read. at the top currently, and then our proposed change. So we had a request, and originally there was a resolution on the formation of FAB, and that the members should not serve more than 2 consecutive terms. And when the bylaws were actually, I guess, approved in an expanded version, it changed it to just 2 terms, 2 3-year terms. So now we'd like to go back to the original wording so that members who have termed out and are interested in reapplying can have that option. So the proposed change says no member shall serve more than 2 consecutive terms. However, members can apply for reappointment after being off the Public Health Advisory Board for a period of at least 1 year. And this isn't an automatic appointment. It still has to go, the candidate would go before would submit an application and be interviewed before the chiefs of staff, and their nomination would go, or their recommendation would go to the board, the individual supervisors, who would then nominate or decline to nominate the candidate. And subsequent to that, at another board of supervisors meeting, if there was a nomination, then it would be voted on and approved or not. So, so that's what we are currently going to vote on, this particular change, and I'll take a vote on that first before we go to the second change. So again, I think we'll just raise our hands so we can count. So is there a motion to accept this change of the bylaws, this first change? And I'm not seeing the whole screen, so let me just do that first.
This is Barbie. I'll make a motion to accept the first proposed change.
Oh, thank you, Barb.
This is Joe
Yes.
Phil, second.
Wonderful. Thank you, Joe Phil. Okay, so now we shall vote. If you vote in the affirmative to accept this change, could you please raise your hand or your thumb or anything you want and let me know, and I'll count those. 4, 6, 7. Okay, 1, 2, 3, 4, 5, 6, 7. Okay, we're good, including I did only count Joe Phil's once, so we're good. Oops, where did I go? Now I just, oh no. Okay, hold on, I just lost this meeting. Am I off? Oh God, okay, I'm back. Thank you. We can put our hands down, and motion is accepted and voted on and approved. So change 1 is a go. We're going to the next issue, which is changing the bylaws to reflect going from the original wording that the executive committee will consist of a chair and vice chair. And that should be, this is the original verdict, because we did change from 2 to 3 already. But the change would include going to a chair, vice chair, or the option of having 2 co-chairs and 3 members at large. So this change has been instituted because after serving on the board for actually serving as a chair for 3 years, I wanted to ensure that I could strong arm somebody into taking it. And it seemed like this was the way it was going to happen, making it a 2-person job. So we have 2, I'll go after, we'll talk about the candidates later and vote on them. But could you please tell me if there's a motion to accept this change, or are there any questions about the change in the bylaw wording? Having heard none. Okay, please, is there a motion to accept? And is that Steve with a hand up still? Is that your motion?
It was accidental, but yes, I'll move.
Oh, okay, thank you. Okay, and second the motion?
I'll second Barla.
Thank you, Sanal. Okay, so we will now vote with our hands and our thumbs to accept this motion. All right, We have 8 members voting in the affirmative, so the change is accepted. Thank you very much as we move right along. So now that we know that we can have 2 chairs, we will go vote on the nominees for those positions. First of all, are there any questions about this? Are there any other people who want to nominate others or themselves for this position? These positions, rather? Okay, so the 2 brave souls who are nominated, we shall now vote on their nomination. So please raise your hand if you vote in the affirmative to accept Libby and Sonal as co-chairs and leaders of your board. Okay, well, we have enough votes in the affirmative. You are now the incoming co-chairs of FAB. Congratulations. Okay. Excellent. Thank you. Thank you for that. Oh, well, you're in good shape now. You have excellent leaders in January taking over the helm. All right. So we will now discuss the nomination of the 3rd executive member. Oh, actually, now that I think about it, okay. Yes, the remaining 3rd executive member of the committee, the executive committee. So we discussed last month about nominating Bakalu. He has accepted this nomination, and I invite people who want to vote in the affirmative to raise your hands on this nomination. Oh, good. Okay, we have a majority vote, and now we have a unanimous vote. All right, Bakalu, congratulations. You will now join the ranks of the executive committee. Okay, we're on a roll. All right, excellent. Thank you. All right, as we move along, we now will discuss, and Nick will bring up the recommendations from the Mental Health Board. The Mental Health Board is a very, very critical board in this county, and they present a report every year. They produce a report and present it to the Board of Supervisors. Right now, they have recommendations regarding mental health, behavioral health services provided to individuals detained in Sacramento County jails. This is something that is actually being presented. They have received, the Board of Supervisors has received this report, but Corinne, the current chair of this board, is presenting these recommendations today at the Board of Supervisors meeting because it's very relevant to what they're considering in terms of how to solve the problem of jail overcrowding and the consent decree and how to comply with that. So I have brought this to you in hopes that you will approve of these recommendations and endorse them from PHAB, and Corinne can add them to the list of boards endorsing them as she presents them to the Board of Supervisors. So I'm asking, I think, Nick, you can make this a little bigger. And this went out and with the agenda and was posted on our website. I'm hoping you've had a chance to review these recommendations. And now I'd like to open it up for discussion before we vote on whether FAB would like to endorse them. Barbie, a question? Or is your hand still up for voting? Libby, you have a question?
Yeah, not a question, actually. I think maybe just to kick off the discussion, and hopefully folks had a chance to read this. It's a very long and thorough report, but the summary here captures the spirit. I think just useful for people to know that a lot of the language in Dr. Corinne's report and in the recommendations specifically actually builds on the recommendations we as PHAB already made to the Board of Supervisors. So it's not necessarily particularly new or different. It kind of resonates with guidance or recommendations we've already made to the Board of Supervisors. Though there's of 1 through 6, I would say 1 through 3 are really mirror what was already in our recommendations. And then I just would say I really liked I think it was 6. If we can scroll down a little bit, there was a very specific recommendation around trying to increase compensation and attraction incentives and benefits to address the staffing shortages. So we had talked about staffing shortages, but I thought that it was nice that they went a little bit of a step further. So just to say that it's pretty similar, I think, to recommendations we've already made, but happy to hear from folks if they have questions or concerns.
Yeah, thank you for that, Libby. Okay, we don't have further discussion. Anybody has anything they want to say or a question? Okay. If not, is there a motion to accept these for PHAB to endorse as a board?
Yeah, motion.
This is Phil, motion. Oh, second.
Thank you, Libby and Phil. Okay, so please vote in the chat if this is something you'd like to approve of. And let's see. Okay, we are unanimous. Excellent. Almost. Phil's out there. Okay. Well, it passes, and I will convey this to Corinne, and if she hasn't presented yet, and I don't think she has, she can let the Board of Supervisors know that PHAB endorses these recommendations. And so thank you very much for that. I'm going to ask if there are any public comments or any further points of discussion. We have a lot of time today. What an unusual thing on our agenda. We can discuss anything, actually. And I see a couple of hands up, but I think that's are those residual from voting. Okay, Joe-Phil, are you there? Okay, Joe-Phil does double duty sometimes. He has.
Sorry, I'm here. I meant to lower my hand after the last vote. I apologize.
Thank you. No, not a problem. Sarah? I think you're.
So really interesting, you know, the CDC had put out a bid that was unprecedented for $3 billion. And it was just awarded, and that particular bid, it's strengthening the, and I'm, you know, we're all very acutely aware of the public health workforce. We heard about it today. We know about it well, I think, in many ways. But it was interesting. They just released the award itself, and there were 2 components. One, which is the governments themselves, along with partners, would apply for assistance, and that was component A. And then component B was earlier in the RFI was to provide technical support to different states and so forth. So without getting, and then of course when they awarded it, it kind of got a bit more specific on what they're doing. But what's interesting is in the award itself, maybe I can just drop it in here for California. You'll see that oh, can I do anything in the chat, or we don't have that capacity?
No, we don't.
That's right. I forgot. Well, that said, so that said, what's interesting, this was just awarded last week for Sacramento County Health Department. There's 15 million, just over 15 million that was awarded for strengthening the the workforce. It's really focused on US public health infrastructure, mostly workforce, a bit on data systems. So I didn't know if that's going to impact, strongly in the county as we're hearing about different issues. I think PHI, the Public Health Institute, is providing assistance, I know, to CDPH, but I'm not sure about Sac County. But I thought it was exciting, important. I don't think CDC has ever put out a bid in the United States for $3 billion and then allocated across the country. But it was good to see Sacramento the county receiving 15 million directly for public health workforce. So I don't know if we have anyone who knows anything about that, but it was good to know. Thanks.
Yeah, I can address it. So about 1.5 years ago, we received an initial amount of money from CDC for infrastructure building. It was mainly to address health disparities. And so that money was actually supposed to come to an end in December, but they did extend it. But they also, in the feedback that they were getting is some of the challenges that counties and states were having was being able to get the work going and also get more permanent positions when you have only funding for 1 or 2 years. So they did say that they were working on being able to extend it. So I think what you saw with this infrastructure build was more of the same, but of course it was a much larger pot. And yes, we were notified that we got 15 million. We still have to clarify some things because I think it's 15 million over 5 years. And so we are planning to submit a request to the Board of Supervisors, one, to accept the money, and also that will help us in getting additional positions. Once I have a clearer picture of how it's all going to fall together, I will definitely bring it forward. And actually, I think you've reminded me, I did say that I would bring to you also some information about how we're planning to spend the future of public health funding, which is ongoing funding that is coming to Sacramento County in the tune of 7 million per year. So I will put all of that together and be able to present it to you, and also explain how we feel that it's going to help us in being more prepared to deal with things like pandemics and other issues that are coming up, as well as being able to provide services to the community and also strengthen our collaboration with communities.
Olivia, just to clarify, that 7 million, is that for 5 years? 7 million a year?
So the future of public health funding is state funding that's coming from the state general fund. It's 7 million per year, and that's ongoing.
Without a date?
I'm sorry?
Without an end date?
No end date.
Okay.
And then the 15 million from CDC is a 5-year grant. We're still trying to clarify some things about the specifications for that grant, and then also be able to request positions from the Board of Supervisors. So I don't have all the details on that one, but we did get notification recently that it's 15 million.
Wow. So this is a very different picture than it was 3 years ago. Thank goodness.
To say the least.
Say the least. The tide has changed, and hopefully public health will never have to face the situation it did at the outbreak of the pandemic, when understaffing and lack of funding was an issue for decades. So may this be the end of that era and the beginning of a new one. I do want to ask you about accreditation, because that was a big issue, and it had to get put on hold. So would you like to give an update as to where we are with that?
Yes, we are in the process of, because of course, all the work we had done before, we have to start from scratch. So we have to put together a community health assessment and community health improvement plan and strategic plan. We have submitted our intent to apply to the public health accreditation board. So we are a step further than what we were able to do before. And also, fortunately, because of all of this additional funding that's coming, we actually have a team now that is dedicated to ensuring that we are able to go through the entire process, put everything together. The last time that we tried to do this, we were trying to do it with our existing staff, and Nick and one other person, Stacy Kennedy, were basically trying to do everything. This time we have a team of 4 people that are dedicated just to the accreditation. And so actually, some of them will be, 2 of them will be funded through the Future of Public Health, and 2 will be funded through the CDC grant. So that's one area where this is all going.
Excellent. That sounds terrific.
So definitely once we have the community health assessment and community health improvement plan put together, which should be maybe between June and September of 2023, we will be ready to come and present to you and then let you know what the next steps would be.
Thank you very much for the update.
So what, oh,
Yeah, go ahead.
so what was interesting in the award that was granted, right, so there were 2 components, and component B was really intended to be technical assistance, like all kinds of assistance with hiring strategies, retention strategies, and the like. But if you look at the way and who it was awarded to, what's fascinating, to your point, you brought up accreditation, Farla, excuse me, is that really the accreditation was a small piece of the RFI, but the award itself for component B for the overarching TAs is really heavily focused on accreditation when you look at the 3 groups that won the award. So it'll be, I think, interesting to see how that all plays out and hopefully benefits Sacramento County. So thank you. Thank you. That was really helpful to hear. Thanks.
Okay. Are there any other comments or questions on any other issues now that we have a little bit of breathing space in our meeting today? Okay. If not, and there are no public comments, I presume, are there any? Having seen none or heard none, well, then I'd like to thank everybody. It's my last FAB meeting as chair, so it's been amazing, and I want to thank everybody for their support, and I will be attending, thank you, the meetings. I'll be helping with this transition, and so I won't disappear. Thank you very much.
Thank you again for your leadership.
Thank you. Thanks, Farla.
Thanks for everything,
Congratulations.
Farla.
Thank you, Farla.
Thank you.
Yes, thank you.
Thanks, Farla. Thank you, everyone.
Thank you. Okay.